Assalamualaikum warahmatullahi wabarakatuh. Good night. Kami di sini kami dari kelompok 2. Sebelum itu kami akan memperkenalkan diri kami masing-masing. Saya sendiri Andana Rizky.
Saya Muhammad Syarabi.
Ya, Rabiatul Adawiyah.
Oke. Udah sih dia. Jadi kalau kami jelaskan tentang dia udah. Dadah.
Hello guys, this is me. I wanna tell you about a daily activities as nurse in hospital. Are you ready guys? Okay, nurses are highly trained member of medical staff who use their knowledge and skill set to support patient through operation and procedure, develop treatment plan, and offer advice on outpatient care. Most nurses have a very schedule, so a day in the life of a nurse can include a wide of range of duty. In this video, learn about a typical day in the life of a nurse, how work setting can affect your duties as a nurse, and see relate specialized nurses to help you determine the right nurse career path for you. Nurses work as part of team of frontline healthcare professionals who diagnose and treat patients in various settings. Nurses work with multidisciplinary team including surgeon, physician, specialist, assistant, technician, and many others healthcare provider. Their daily duties may include taking patient vital signs measure and medical history, asking about the patient's symptom, performing physical examination, drawing blood sample, requesting and conducting diagnostic tests, recommending care option the physician, administering medication, maintaining accurate and detailed record, consulting with other healthcare provider, educate patient on how to manage their condition, providing emotional support to patient and their families, implementing and assessing care plans, recommending search of support for patient, sharing relevant patient information at shift change such as admission, discharge and change in patient's condition, setting up treatment rooms, sanitizing and assembling medical equipment, checking and counting medication, completing patient assessment, administering wound care, changing dressing, and the daily routine of nurse rarely are the same twice. Working on the front line of patient care means that they are always interacting with people who are in stressful situations. So nurses need to be empathetic and work well under pressure. They also have to react appropriately to emergencies and expect even so good problem solving skill and quick thinking about ideal qualities for nurses.
Okay, first I want to tell you a little bit about the impression in the orchid room and share a little of the thing I figured my orchid. So my experience in hospital next for the first time in my life was November 21, 2019. The day I enrolled Umi and Aldi confident that tonight will be an evening of fun. We are in the orchard room and yes we pause the conference. After the post-on conference, we had track activities and nursemaid. Yeah, responsible with patient being given our share of nursemaid, giving drug by night. Before long, one of the patient room was buzzing because a new child was out of surgery with tonsillitis, bleeding or bleeding. Yes, the boy vomited blood so much and was hot fresh blood as texture mixed with saliva. The first book was unstoppable and fell to the floor from the height of the boy's bed, sending the blood down with there. Then the parents panicked and called us on standby. By chance, in was my brother room Nurul Umi Aldi. I was so pressured I had to do it. Not that we knew what we were doing, but it took us 30 seconds to guess what happened and what we were supposed to do. I immediately glanced at the Hocket man. Crockett in the name of Crockett saved container in the file of Crockettness of nursing home to collect medical was during the course of nursing. Yeah, been I take it to the kid and blame his own vomit without gloves. So much bleeding for the kid after his tonsil operation. There's like 300 cc. The one next to the bed tonsil operation was that bad. Kids don't know the difference between tonsillitis. What did do after that? Instead, we laugh. Seriously, we laugh. The patient was so poor, his parents were willing to give blood from the mouth of his child until morning come. After the massive hemorrhage, the child did not stop bleeding for his mouth. A little parent's sacrifice was so great that the child was planning the return to the operating room tomorrow morning, so the doctor could explore the operation.
Hello, are you busy right now?
Hi.
Can I ask your opinion regarding the intervention that can be done to my patient?
Note, there's what?
The nursing diagnosis is sleep disorder.
Yes, you can, but what is the nursing diagnosis of your patient?
After I got the diagnosis, I've thought how to regulate activity and rest. Also, I have modified the room so that the patient feels comfortable.
Oh, I see. So, what nursing actions have you done?
It didn't work.
Did it work?
After I evaluated, it turned out that his sleep pattern disorder was not resolved. I tried to adjust the semi-polar position to the patient because he was dizzy, weak, and felt the bed was too flat.
Other than that, is there any further action?
It worked, but sleep disorder is only partially resolved.
It didn't work either.
So, do you have an opinion?
Oh, I see.
Maybe I can try to apply in the patient. Okay, thanks to your opinion.
From your explanation, your activities are in accordance with the nursing interventions that have been made. You also include music therapy in your nursing interventions to help patient relax. Maybe your patient is tense or having a lot of drugs.
Anyway, what's wrong with you? Why is it so wrinkled?
I'm confused.
Confused?
Yes, I had the assessment to make nursing plans for a particular patient, and I am still not clear on that.
Oh, about the nursing plan. Well, according to Manurung 2011 say, nursing planning is a written course of action that describe the patient health problem, the result that will be expected, the patient specific nursing action and progress.
What are the details of the nursing plan?
In it are numerical column, column of day, date and hour, diagnostic column of nursing, goal and nursing criteria, and what then.
I had a quick look at this, plus an intervention, rational, and a psych nurse.
Yeah, you're absolutely right. I'm getting some sample of the nursing plan, like in diarrhea patient. Here, watch the phone.
Oh, for example, in patient diagnosed with diarrhea, the results are triggered with a strongly intestinal tract of 10 till 15 times per minute, and iod is prescribed to replace electrolyte fluids as an intervention. Is that so?
That's right. Now you get it, right?
Yes, I get it now. Thank you.
You're welcome.
Terima kasih telah menyaksikan video kami. Dadah!